my name is Nicole Menendez, and I'm going to be talking about aortic aneurysm. What is an aortic aneurysm? An aortic aneurysm is a localized dilation or bulging of the wall of the aorta, which is the large artery that carries blood from the heart to the rest of the body. The bulging of the wall of the aorta is caused by a weakening of the blood vessels over time, and this causes a balloon type situation to happen where that area of the wall is weakened. Once the aorta starts to balloon, the patient is now at risk for a rupture or something that's called dissection. And once this happens, it causes life-threatening bleeding and potentially death. There's a couple different types of aortic aneurysms, and I'm going to talk about two of them. So the first would be abdominal aortic aneurysm, which is also called a AAA, and there's also thoracic aortic aneurysm. The abdominal aortic aneurysm occurs in the section of the aorta that runs through the abdomen, and the thoracic aortic aneurysm occurs in the section of the aorta that runs through the chest. Abdominal aortic aneurysms often grow slowly and sometimes don't have obvious symptoms. Because there is no obvious symptoms in the initial stages, it sometimes causes difficulty with diagnoses. Some of these aneurysms never rupture and continue to go unnoticed throughout a patient's life, and others grow rapidly over time and unfortunately do end up rupturing, causing life-threatening bleeding. There are multiple shapes that these aortic aneurysms can form. The most common shape is called a fusiform, and this essentially just looks like a balloon out of the sides of the aorta. It looks extremely, almost distended. There's also a saccular shape that can occur, and this looks more like a bulge in one spot of the aorta, and sometimes it's called a pseudoaneurysm. So this is where the inner layer of the artery is torn, and this is usually caused by some sort of injury or trauma to the aorta. There are multiple forms of thoracic aortic aneurysms, the first being the ascending aorta. So this is where the aneurysm occurs within the ascending aorta, which is the part of the aorta that's coming out of the top of the heart. There's also an aneurysm, the descending thoracic aorta, which is the aortic curve that's coming down behind the heart. And there's also a aneurysm of the actual thoracic aorta, which is directly behind the heart. Aneurysms may be caused by a multitude of factors that result in the breaking down of well-organized structures within the aortic wall. The primary causes of aortic aneurysms are arteriosclerosis, hypertension, genetic factors, age, smoking, family history, infections and inflammation, trauma, and there's other conditions such as high cholesterol and diabetes that can contribute to the risk of developing an aortic aneurysm. Arteriosclerosis is the main cause of aortic aneurysm, and this is the buildup of fatty deposits within the arteries that can lead to an hardening and weakening of the arterial wall, making them more susceptible to an aortic formation. Hypertension, which is the chronic high blood pressure, puts extra stress on the aortic wall and contributes to the weakening of the wall by increasing the risk of aortic development. There's also genetic factors that can contribute to the risk of an aortic aneurysm, such as Marfan syndrome, Ehlers-Danlos syndrome, and other connective tissue disorders. Age is also a risk factor for developing aortic aneurysms. With increased age, the arterial walls may naturally weaken over time. Tobacco use and smoking is also a significant risk factor, as it can damage blood vessels and contribute to the development of arteriosclerosis, which again is one of the number one risk factors for developing an aortic aneurysm. Having a family history of aortic aneurysm or any other cardiovascular disease can also increase an individual's risk for developing an aortic aneurysm. There's also conditions of inflammation of the aorta, such as syphilis or vasculitis, that can lead to an aortic formation over time. Trauma, physical trauma, such as severe injuries, particularly those that involve the chest or abdomen, can damage the aorta and lead to an aneurysm over time. I included this visual in the presentation because I like how it demonstrates the initiation and kind of the progression of a aortic aneurysm. So first we have these genetic or risk factors such as genetics, gender, ethnicity, and age. And then we start to see the progression of a aortic aneurysm, and then we add in these risk factors such as smoking, infection, trauma, hypertension, etc. And this can eventually lead into a rupture of that aortic aneurysm. Signs and symptoms of an aortic aneurysm can be difficult to identify sometimes because they're rather vague in the initial stages. So, some things that we may see from patients who are experiencing an aortic aneurysm include difficulty or painful swallowing. This is especially prevalent if the aneurysm is pushing against the esophagus, which is the tube that connects the mouth to the stomach. There's also the potential to have difficulty breathing. This is if the aneurysm is pushing against the trachea or windpipe, feeling full, a hoarseness of a patient's voice, pain in the back of the neck, jaw, chest, stomach area, or shoulder, depending on where the aneurysm is located, as well as a pulsing or throbbing feeling within the stomach area. That pulsing and throbbing feeling is something that can actually be visualized sometimes, especially if the aortic aneurysm is severe. I've only seen this one time in my practice of being a nurse, and it was very scary to witness. You can also the patient will also experience shortness of breath, especially if the aneurysm is pushing against the patient's lungs. They'll also have a swelling of their neck, face, or their arms. And this is if it's pushing against the superior vena cava, which is the main vein that's returning blood from the upper part of the body to the heart. And also, they can experience lightheadedness, rapid heart rate, and in the very severe situation where the aortic aneurysm has ruptured, there could be sudden severe pain and a sudden loss in blood pressure. In that case, it is a emergency situation, and that person needs to get to an OR and receive blood products as soon as possible. So, diagnosis of a aortic aneurysm, there's a couple different ways that these can be diagnosed. The first would be a CT scan or a CAT scan, which is basically a combination of X-rays and computer technology that produce a horizontal or axial image of the inside of a patient's body. They can also undergo an MRI. An MRI uses a combination of large magnets and radio frequencies to produce images of the inside of the body, and hopefully through those we'll be able to see an aortic aneurysm. But there's also the use of an echocardiogram. An echocardiogram is a more specialized form of imagery. It's used to look at the structure and the function of the heart by using different sound waves, almost like a ultrasound, but just a little bit more specialized. There's also arteriograms, and this again is a large X-ray of the blood vessels that we can see the narrowing or stenosis or blockages, and in order to use or to see that, we use a dye or contrast that's injected through the patient's arteries and veins to get a better look at those. And there's also the use of an ultrasound, which just like on pregnant women or other patients, you can use those ultrasound waves to view internal organs. It's not as clear as the CT scan or the MRI, but they're relatively quick and they're portable, so they're super helpful to have at the bedside. So when a patient is diagnosed with an aortic aneurysm, there's a couple different treatment options. If the aneurysm is not severe and really has no symptoms, there is the option of having routine ultrasounds, and these can take place every 6 to 12 months just to kind of watch and keep an eye on it, and make sure that there aren't smaller aneurysms that are developing and that there's not additional weakening of that wall, of that arterial wall. There's also controlling and modifying risk factors. So, we're going to want these patients to stop smoking, control their blood sugars if they're diabetic, or lose weight if they're overweight or obese, and controlling dietary fat intake. So, we want to make sure that they're not progressing that arteriosclerosis and they're managing their weight so we're not causing excess stress on their vascular systems. There's also medication therapy, such as treating the hyperlipidemia, which is that high cholesterol or that high blood pressure. Again, wanting to avoid putting additional stress on that patient's vascular system. So, treating those conditions can help with that as well. In severe cases, there are open aneurysm repairs, which is a surgery essentially to go in and visualize and repair the aneurysm. There's a couple different ways that they can do this. There's grafts, there's various things that they can sew into the blood vessel that can help strengthen that wall. And it's considered a standard for an abdominal aortic aneurysm repair. But there are a lot of risks associated with aortic surgeries. So there's also some studies going into looking at the use of doxycycline, which is a triglyceridic, a tetracyclic antibiotic, and it's used to help stabilize the aortic aneurysm. Thank you for listening to this presentation on aortic aneurysms. Thank you.